Hello, this is Dr. David Green, CEO of the Washington Pain Network. Today's topic, an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to provide the desired outcome. The result is chronic pain, which is termed failed back surgery syndrome, or FBSS. It's one of the most frustrating things a patient can deal with, since he or she actually went the surgery route hoping for a pain-free outcome, and it just didn't happen. Studies show that up to 40% of all back surgeries fail. 10% of back surgery patients actually end up worse than they were before. Each additional surgery that is performed has a lower chance of success than the one before. Overall, it can be a very depressing situation. Why does it occur? Well, the first reason is that surgery could have been performed for the wrong reason. 50% rule is that even the best trained, fellowship-trained, board-certified spine surgeons who've been in practice for a long time, they still get the diagnosis of why a person has back pain wrong 50% of the time. It just is what it is. The second reason is that surgery could be performed for the right reason, but the person could be left with residual pain. I mean, this could be a technically perfect surgery in a textbook, looks great, but still it might not be a home run. The third reason is that surgery could have been inadequately performed. Fourth is that maybe the hardware looks great, but fusion didn't occur, and then the hardware continues to take a lot of stress and it breaks. Then the pain can really shoot up. The fifth reason is that the outcome could be satisfactory initially, but then scar tissue could form around nerve roots. The hardware could become painful. You could end up getting adjacent segment above or below, accelerated arthritis and degeneration with pain. So here's adjacent segment degeneration. You see that a fusion was performed between these two levels, L3, L4, L5. Okay? Now, what's the biggest problem is that you end up with a lot of degeneration above. See how there's really no disc space here? I mean, that can cause a lot of pain. Okay? So the symptoms of failed back surgery syndrome could be daily back pain, which may radiate into the left and right sides of the back. Spasms and aching can occur, and then a person can get leg pain and burning if there's nerve roots being pinched. The treatment options for failed back surgery, one should be a surgical evaluation. If there's broken hardware or adjacent segment degeneration or fractures, that should be evaluated and treated appropriately. If not, then physical therapy and chiropractic treatment may be very helpful. Spinal decompression therapy can help a lot, even for a fusion, but if there's hardware in place, then it's contraindicated. Acupuncture has been shown to be extremely helpful for failed back surgery syndrome. And then medications. This may include over-the-counter medications such as anti-inflammatories and Tylenol, or for short-term pain relief, it could be narcotics, muscle relaxers. Neurogenic medications can be very helpful too, such as Neurontin and Lyrica. Now, interventional procedures. Trigger point injections can be very helpful for the muscle spasms and aching. Injections around the hardware to see if that's painful can be helpful. Facet or medial branch blocks can be great. This is an example of a radiofrequency ablation. These are little nerve endings called medial branches. They supply sensation to these facet joints. Now, if you have pain in these joints, it can be relieved by either a medial branch block or an injection of numbing medicine directly into the joint. Okay? Now, if that works and then wears off, this catheter can be placed and you can get a radiofrequency ablation which heats up this area and deadens these little nerve endings. And that can provide pain relief for 6 to 18 months. If nerve roots are being pinched, then an epidural injection is the way to go. That can be performed as a series and be repeated every few months. If all else fails, the last resort has been revolutionary for failed back surgery syndrome, and that is a spinal cord stimulator implant. Those have been performed for over a decade, but over the last 10 to 15 years, they've really come a long way with the technology. They've been shown to be good for both back pain and leg pain. There's over 200 programming options available. This here goes over the buttock area, or it can wrap around and be put subcutaneously around the abdomen. But this is a battery and a programming pack, okay? And they're much smaller now than they used to be. I mean, you can hold them in your hand. They're so light. But anyway, that can be recharged from outside the skin. You don't have to replace it fully when it dies. And these leads go subcutaneously and then deep down around the spinal cord. They submit electrical impulses and they change the way the brain perceives pain signals. As opposed to pain, say in your leg or low back, it changes that to a tingling sensation. Over 3/4 of patients do extremely well with spinal cord stimulator implants. Now keep in mind, it doesn't fix anything, okay? It just masks the pain, but if you can't fix it, you might as well mask it. The top non-operative pain management for failed back surgery is with the Washington Pain Network. They have affiliated clinics throughout Washington, accepting over 50 insurances and providing over 25 treatment options. The success rates overall for pain conditions exceeds 90% with the board-certified award-winning doctors. Visit us online today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.